everyone, and welcome back to the Lube Tube. My name is Jeanette, and this is my co-host, Brittany.
Hello, Jeanette. Happy middle of April.
I know, everyone. Tomorrow is Brittany's birthday, which when you're listening to this, it'll be yesterday. So just remember to give her a little shout out on Instagram. Can't believe you're going to be 28 years old.
I know. It's beautiful. It's really beautiful to be young and vivacious. Thank you.
You're welcome. You know, the older I get, like those numbers keep going up. Like, oh, to be 28 or oh, to be 29. I would kill for my 30-year-old self right now.
I mean, I actually, age is just a number, Jeanette, and you're only as old as you feel.
Oh,
right.
Okay. All right. Well, I feel much better about that.
Mm-hmm. Mm-hmm.
So I am 55.
That's not what I meant, but
okay.
Yes. Well, we're working on bringing that number down.
Yes, absolutely. Well, anyways, today's episode, we're going to be talking about what happens when you get an abnormal pap smear and what does that mean, and kind of what the next steps are whenever we do get an abnormal pap smear and how we should not freak out, right? Because
Amen.
I don't know about you, but most women that I talk to, if they hear that they've had an abnormal pap smear, they freak out. And that's totally understandable, but it doesn't mean it's absolutely necessary to do so, because most of the time it's going to be okay. So
right.
I think it's important that we chat about this so we can kind of educate the ladies on kind of what to do when they get this abnormal pap smear.
Absolutely. And there's a lot of people listening that have probably had normal, but the chances are at some point in your life, you may get an abnormal, but we're going to talk about all the reasons that this could be and why it's okay to take a deep breath and let all the things happen. So
absolutely. Because it's like 1 in 20 paps come back abnormal, which is crazy because obviously I look at results all day long. And I would say that they come back abnormal either because of atypical cells that are due to infection, or there are some abnormal cells that need further testing. But I see quite a bit of abnormals, and most of the time they come out just fine when we have to do any further testing. So let's talk about it.
All right. So why don't we just start with the obvious question. What is a pap smear? How often should we be getting it?
Yeah. So a lot of women think that the annual exam is the pap smear, but it's actually two different things. So an annual exam is when you're going to come and see your provider once a year. And during that exam, they will probably do a breast exam, an abdominal exam, and a pelvic exam. The pelvic exam is actually where the pap smear can or cannot be done at that time. Not everyone gets a pap smear every annual, and that is going to be patient and provider dependent. And so the actual pap smear itself is us taking this little plastic brush, and we actually look at the cells of the cervix being the very opening of the uterus itself. And that's actually what dilates when we're having babies. And that area is where we can check for cancer cells or changing of the cervix that could lead us to thinking that we need more testing. So basically, when you come in and you have the pelvic exam, I'll take that small little brush. And when I'm able to visualize your cervix, I will brush the cervix with that brush and then send that off to the lab where they then will test it for abnormal cells.
Have you seen these TikToks of people? I mean, they're obviously like parodies of like what a pap smear is. And like they show it and it's like a package, like literally like an Amazon package. And then they clearly have the camera in there. And then they have like the tongs going in.
Yes.
And then they'll bring in like a toilet brush for the... And I mean, it's kind of accurate.
I know. And it doesn't feel like that, I hope.
It really, I really think a pap smear is just like a lot of other things where you build it up, and then you get it and you're like, that was really nothing.
It's so true.
One thing that I know we've said before, but I want to reiterate again, a pap smear really shouldn't hurt. If it hurts one time as a one-off, okay. But if it continues to hurt, A, say something to your provider, and B, if they don't react in a positive way, then find somebody that will.
Absolutely. Seriously. Like we need to find a provider that will make you feel comfortable, explain everything to you. You know, I know we've talked about this multiple times during our episodes, is just feeling comfortable with your provider and being able to ask those questions. So yeah, great point, Britt.
Thank you.
Absolutely.
Thank you. Okay. So let's move on. When you do get the abnormal, what really does that mean?
Okay, so abnormal's funny because it can be like 5 or 6 different things, right? The most common thing I see is something called ascus, which I think is so funny because I heard one provider say, don't ask us because we don't know what it means. Because
that's great.
It stands for atypical squamous cells of undetermined significance. So we don't really know why they're abnormal. Most common reason is inflammation due to infection, right? But they came back as an abnormal cell on that pap smear. So it requires more looking into. Okay. So it basically looks, when they look at it underneath the little microscope, they're just a little off and we're not sure why, but usually it's because of things like bacterial vaginosis, yeast infections, vaginitis. Maybe you had sex the night before, right? And it kind of irritated the cervix. Maybe you're on your period and things are a little bit abnormal there. So yes, so it usually means nothing, but it's something that we do get back as an abnormal pap. And so depending on what that comes back as, if there is HPV also associated with that abnormal ascus pap, then that will tell us, do we need further testing? Okay, so
I have a question.
Go ahead. Yes, ready.
So if a patient said, since you said sex could potentially cause this from like inflammation, would you be telling your patient or would you be advising your patient, hey, maybe like hold off from sex a day or two before you come see me?
Yeah, it's actually a good idea. So if you haven't had, I would recommend like no sex the morning of, the night before, if you're having your annual exam the next day, because it can't throw the pap off. So I would recommend not doing that because it will absolutely, not in all situations, but it absolutely can.
Thank you, ma'am.
You're welcome anytime. But I think the big thing here, and we always got to remember this, is depending on the age of the patient, right? We always test for HPV. And that is going to be 30 and up, right? Anybody that's below 30, pap smears start at 21, like we talked about during our annual visit episode. But if you are coming in to me for a pap smear, I'm not checking HPV on you unless you're 30 and up or you have a history of abnormal pap smear, right? So say it comes back abnormal and you're 25 and it comes back as ascus. What's going to happen is it's going to reflex and it's going to say, hey, this came back abnormal, and it's going to go back and tell the lab to go ahead and run the HPV on top of that, right? So I always do a reflex HPV on anybody 30 and below.
Okay.
Because that HPV positivity will tell us what we need to do for our next step.
Right.
Another pap smear that can come back, or another way another pap smear can come back abnormal is something called LSIL, low-grade squamous intraepithelial lesion, okay? That sounds really scary, right? That sounds extremely scary. And that just means that there's some mild changes on the actual pap smear itself. And these are normally caused by HPV, okay? These often will just go away on their own, okay? But in most of these situations, people are going to get a colposcopy, okay? A colposcopy is literally where we go in and we look at your cervix and we put something called acetic acid over the top of the cervix, AKA vinegar. And the cells that are abnormal will actually turn a different color. And we look at them through a microscope that we have. That's a large microscope that we're able to look down the vagina and at your cervix. And we look at those cells under different colors. So red or green or just normal scope. And from there, we can do a biopsy if something looks abnormal from that actual scope. Another one is something called HSLIL. Okay. So high grade squamous intraepithelial lesion. Okay. These are usually, and what that means that there's a little bit more serious cell changes that could possibly turn into cancer if it's not treated. Okay. So these patients are absolutely being HPV tested, and these patients are absolutely recommending to get that colposcopy. Okay. Another one is atypical glandular cells, okay? Atypical glandular cells are actually where the cells are on the inner lining of your cervix. They actually almost look like endometrial cells, okay? So these cells are going to be inside the cervix, and these will require a biopsy, okay? Not just a colposcopy, but actually an endocervical curettage, which is where we actually go in and do an ECC. It's where we get the cells from the inside of the cervix, but also doing an endometrial biopsy where we get the cells from inner lining of the uterus, okay? So not everybody obviously needs all these testings, and it's going to be dependent on what your pap smear came back with and whether or not your age, your history of previous pap, and then also if you're HPV positive or negative.
Right.
Okay.
So if somebody gets a pap result or an abnormal, I should say, and they see something like high grade or, I mean, even low grade or the, atypical, these are words that they should be paying attention to, right?
100%. Yeah. You want to see negative for intraepithelial lesion. Okay. NIL. Okay. That's what you want to see on your pap. You want to see no atypical cells found. You don't want to see, well, it's okay to see atypical squamous cells of undetermined significance. It's going to be okay. Like you said, it's usually caused by infection. But if you're seeing HSIL or LSIL, or you're seeing the AGC, which is atypical glandular cells, those are things that are going to require more testing. And if your pap smear is coming back with that and your provider is just saying, oh, it's no big deal, we'll just repeat it in a year, you might want to get a second opinion just to make sure that a colposcopy is not absolutely recommended.
Right. Because I think we can both agree on this, that because abnormal paps happen so frequently, sometimes patients' follow-up gets lost.
Yes.
And whether that's from, a lot of times it's from the patient side because maybe they've had abnormal paps before and nothing came of it.
Right.
And so they are kind of like, whatever.
Yeah, exactly. Or, I have some patients that, have had a colpo and they're like, oh, the colpo was fine. Why do I need to keep having these pap smears? Well,
right.
Cells can still continue to change. And although we didn't find anything, and thankfully didn't find anything on your colposcopy, that doesn't mean that your future paps will not show something that is abnormal as well, or maybe even furthering of those abnormal cells. So our whole goal is to catch it when it's ascus or LSIL, not to catch it when we're all the way down at HSIL leading to cervical cancer. There is something else called an adenocarcinoma in situ, or AIS. These are actually precancerous glandular cells on the cervix. And this obviously also requires a colposcopy and an endometrial biopsy, usually depending on the provider's choice. Okay, so that's very, very rare that I've ever see that, but obviously it can also be a reading that you would get on your pap smear that requires further testing. So, I think it's also important that very rarely a pap's going to say you have cervical cancer, right? What's going to tell you whether or not there's cervical cancer is the actual colposcopy with biopsy, okay? So a pap smear is just going to give you these reports. It's not going to tell you, yes, there is cervical cancer there. So even if it comes back as LSIL or HSIL, that is not telling you that you actually have cervical cancer. That is just telling you, hey, you need further testing, which is going to be the colposcopy. And say the colposcopy comes back and we do biopsies, and then those biopsies show that, yeah, there's some definite issue here. Well, then that's when we go in and recommend usually a LEEP procedure. Okay. And a LEEP is actually where we go in and actually remove that area of the cervix that is containing those abnormal cells that were found on the colposcopy. And from there, usually depending on what's found on the biopsy from the LEEP, it's decided on how often that patient needs recurrent pap smears. Usually it's going to be every 3 months and then every 6 months and then once a year. But depending on your results from the colposcopy, then leading to the LEEP procedure will determine how often you need repeat pap smears.
You've used so many acronyms.
Oh, I'm sorry.
Yeah, no, well, I mean, you have to, because it would be very wordy. But I'm just want people to know that these acronyms actually do mean things that you could look up.
So the LEEP is basically a really big, if we set it all out, it's going to be basically, it's where we go in with an electrosurgical device where it basically burns off that area of the cervix. You usually are going to be asleep during this procedure, or if we do it in office, we've given you pain medications and usually laughing gas, and we're definitely controlling that pain with pain blocks. But a lot of times, most women will opt to do that in a surgical situation, right, in an operating room. And we're literally taking this electrosurgical device or tool that we have and burning off that area of the cervix. Okay. And so as it cuts, it's also doing cautery, which is stopping the bleeding. Okay. So that's what that means.
What about cryotherapy?
Yeah. So cryotherapy is going to be another option where we actually go in and kind of freeze/burn those areas of concern. It still has pretty much the same follow-up, right? We're still going to need repeat paps. We're still going to make sure that all those cells are gone. But a LEEP is where we actually go in and actually remove those abnormal cells.
Can I just, a sidebar, have I told you about this place in Comfort, Texas?
I love Comfort. So pretty there.
Oh, well, there's this place there where they're freezing dead bodies.
Okay. You just ruined Comfort for me.
No, it's wild. And I forget what it's called. Oh my, it has like, I think it's called like not the mothership.
Okay.
I don't know. It's called something ship. I
Uh-huh.
remember that. And they are freezing dead bodies in hopes that the technology will get to the point where they can at some point bring these people back. And people are paying money to do this.
Really?
In Comfort, Texas.
Really? Now I got to Google it.
Yeah. And it seems a little culty in my opinion, just because they're like, they have a ton of land and they're building this apparently like state of the art. And I actually don't know enough to be talking about this on the podcast, but you know that I typically do this. So my apologies. But hey, look it up. It's
You know a little
pretty
about
wild.
a lot.
I know a little about a lot and a lot about a little.
So we went from cryotherapy to basically freezing your entire body.
Yes.
Yes. Perfect.
And it's not only in Comfort, Texas. It's everywhere. People are doing this. But I just thought it was interesting because when I think of Comfort, I think of wine.
Yeah. Beautiful Texas Hill Country. But now I'm going to go up there and look at frozen bodies. So thank you for that.
My pleasure.
Yes, absolutely. Always helpful.
Okay. So I guess let's talk about what happens when you get that abnormal pap and like the immediate gut drop for a lot of people.
Yeah. Immediate gut drop is, oh my God, I have cervical cancer. It's everywhere. I, as a female, would think that if I wasn't educated on what to do with an abnormal pap. So my whole goal of this episode is to basically tell you, hey, breathe. It's going to be okay. Yes, we're going to need to do a little bit more testing, but this abnormal pap does not mean you have cervical cancer. So I think there's a huge stigma around it too, right? That, oh my God, I have an abnormal pap. That means I'm dirty, or I have HPV, which I got through sexual contact. And, I just feel like as women, we're immediately thought that, oh my God, I had a bad pap. Maybe I'm not healthy, right? Well, that's not true, right? HPV, and like we talked about before, men do not have symptoms of HPV unless they have warts, right? And so if they don't have warts,
hate it.
Okay.
This is unfair. This is unfair. I will say it again. Us as women, we get the short end of the stick, and I will die on that.
Absolutely. And I think this is basically like, it's a checkpoint, right? Come see me. Let's get your pap smear done. Let's do this checkpoint. If it's normal, we move on. If it's abnormal, then we move on with the plan, right? But number one thing you could go and do is get the Gardasil vaccine. If you believe in vaccines and this is something you want to do to protect your body, the Gardasil vaccine has now been approved. I want to say it's 45 and below. It used to be only up until like 20s, and now it's been approved for 45-year-old females, which this is great, right? So if you have any history of HPV and you've had a history of an abnormal pap, or maybe you have a history of HPV, but normal PAPs, then absolutely recommend you getting the HPV vaccine, because not only could it help prevent other further strains, it could also help your body fight the current infection that you have. So I'm a huge proponent for that vaccine, obviously. And then, if it's a new partner, safe sex, right? Condoms, right? The only thing that's going to protect you from getting HPV is a condom, okay? And especially since they don't have any symptoms. So if you're having female-male intercourse, then you need to absolutely make sure that you're using a condom, unless you're with that person and you know that you've been with that person for a long time, and obviously y'all have a trusted relationship. But if it's a new partner, then protect yourself, girl.
Yep. And then we've mentioned this before, but let's say you're as safe as you can be.
Mm-hmm.
And then 2 years down the road, you get a abnormal pap, and then there is the HPV diagnosis. There's always the question of, where did I get this from? And unfortunately, there's really no way to tell you, did you get this yesterday, or did you get this
10 years ago? Right.
Exactly.
And that's the most frustrating thing about this virus, not just that it causes cancer, but At the same time, we can't tell you when you got it or how long ago you got it because it will actually stay dormant in the body and not rear its ugly head until maybe you're under a high level of stress, or maybe your emotional state is down, or maybe basically your immune system is being hit by something else right now and it's more focused on taking care of those things. So don't be surprised if it comes back positive. It's not that your partner's cheating on you. I can't say that he or she is not, but most likely it's just that it now has reared its ugly head and you now are testing positive for the virus. The great thing about it is your body can take care of it though, and it can push it right back into dormancy, or we can get rid of it altogether. So that's a huge plus.
So yes. So let me ask a few questions, a few myth-busting questions.
Ready.
All right. If I have an abnormal pap and or if I'm diagnosed with HPV, can I still have kids?
Absolutely. So just because you have HPV does not mean that you're infertile, okay? Just because you have HPV doesn't mean it's going to pass on to your baby. Just because you have an abnormal pap doesn't mean that you are infertile either. Things that start getting us a little worried is that if you have a history of a leap or multiple leaps, and you've had lots of surgery on your actual cervix itself, we are going to do a little bit further testing when you become pregnant because we're going to check that cervical length to make sure that it is still competent to keep the pregnancy. Okay. So that's the only thing. It doesn't mean that you're not going to be able to keep the pregnancy. It's just something that we keep a little bit closer eye on when you have a history of that leap procedure.
Right. And you kind of already answered this. Is this contagious?
Well, the pap itself being abnormal, the abnormal cells, no. But the HPV virus itself, absolutely contagious. But if you have abnormal cells on your cervix, that doesn't mean you having sex with that partner is going to give him abnormal cells on his penis. So definitely you could transmit the HPV virus. But as far as transferring the abnormal cells, no, that is not the case.
Thank you, Jeanette. You're always such the myth buster.
I'm just busting them. Boom, boom.
Okay, it's about that time. It's about that time.
For what, Brittany? Slippery solutions.
We have to decide.
Okay.
We have to decide if one person's going to do it. Okay, let's try it again. But I think you should do it. You have a much better voice.
Oh, thank you.
And yeah, I'll just give it like a little clap at the end.
Okay, like you're going to add a little jazz to it.
Yeah.
Okay.
Yeah, your turn.
Ready? Slippery solutions with B&J. Oh, clap, clap. Cha-cha.
Dear B&J, I
hi.
just found out that I'm pregnant.
Okay.
But I've been seeing 2 different men.
Okay.
Is there a way to do a paternity test while I'm pregnant, or do I have to wait until I have the baby?
Oh, that's a great question. So we do have some new science out where we're testing as early as like 9 or 10 weeks called the non-invasive prenatal test. But as of right now, our normal testing that we do on that is checking to see if the baby has any genetic abnormalities. Okay. This is the test that we can also check the gender on. So we're getting, finding out genders earlier on in pregnancy rather than waiting till the 20-week anatomy scan. But the problem with that is I'm pretty sure there is the science behind being able to do the paternity testing, but it is not covered by insurance. And I know for sure we do not do that at our office, but I do think that the science is out there to do it.
I hate insurance.
I know. The other option is doing an amniocentesis, right? Which is a high risk procedure where they go in and actually get some of the amnion from the baby, and they're able to test the genetics on that. But that is a high risk procedure, and usually it's recommended if the only reason we're doing an amnio is to find out the paternity, then waiting till after the baby is born.
So let me just bring it all together. The science is there, but will it be covered by insurance?
Doubtful.
Probably not.
Doubtful.
So for this particular listener, we would say that you're going to have to wait.
Yeah, I think that, you could talk to your provider to see if they have a lab that would be able to run it off their genetic testing that they already did to getting that because part of the blood work that we're getting is what's called a fetal fraction. So it's a fraction of the baby's DNA that is found in our blood test. Okay. And that's what we're checking for to check the gender and to make sure that baby is healthy. But off of that test, I have seen that they are studying, or maybe even already have the science available to check paternity. So that is an option. I just don't know of any labs that are actually doing that I know for a fact that we're running in our office.
Thank you, ma'am.
Sure.
Okay, next one. Dear B&J.
Hello.
I'm trying to bring toys into the bedroom.
Ooh, good for you.
What is your favorite sex toy?
Oh my God.
Listen, you don't have to answer this one, but when I saw it, I had to ask it.
Okay.
We can just empower whoever this person is.
Yes.
Bring them into the bedroom.
100%. 100%. You know, it really comes down to, and I think we've talked about this during the orgasm episode, how you orgasm. Do you orgasm with clitoral stimulation? Great. If you do, then you need something that is going to be obviously that's more focused on the clitoral area, right? If you are more somebody who gets it from obviously penetrative sex, then you're going to need more of like a dildo, if you will. So they also make sex toys that do both, right? So
a combo, it's called a combo loco.
The combo loco. So if you want a combo loco, they do have those available. And then if you even look, I mean, they have some that vibrate, some that suction, some that do a combo, some that move back and forth, some that are rhythmic. They even have, I mean, I hate to say it, but cock rings that go on his area that stimulate your clitoral area. They have things that are literally just finger size that you can put on your finger. I mean, the world is your oyster when it comes to
really
sex toys, you know?
It really is.
So I think you need to figure out what gets you there and then be able to make a purchase from there. But like we said in our episode about orgasms, most women are clitoral stimulators, right? When they have to have an orgasm. So it's important that you actually find something that works for you, not just buying something that mainstream media thinks you need to be using.
Amen. I actually have to, well, I don't have to, but my sister-in-law to be is having her bachelorette party next weekend.
Oh, yes.
Yes. And obviously I have to like make a purchase of some type for her.
100%.
And is that weird?
I don't think so.
I mean, I don't think so.
I don't think so, but because y'all are so close.
Right, exactly. But my point is there's just a lot to choose from. I actually haven't been to a sex store here I am airing my laundry in a long time.
So,
but
there is like this new one that a lot of my patients have mentioned that actually they think that it actually works the best. And it's something called the rose. And it looks literally like a rose. And it's more of like a suction on the clitoris. And a lot of times women do better with that than the vibration because sometimes that vibration can be a little bit too stimulating.
Mm-hmm.
So
interesting.
So that's all I got for that.
Okay. Well, thank you. I'll let you know what I find. Okay.
Yeah. Let me know. How fun.
I know. Super.
I have a question for you though.
Yeah.
This came up. We were having lunch with some of these girlfriends that I was hanging out with this last weekend. And they wanted to ask about the use of a bidet. And is it healthy, safe, and why isn't everybody in America using a bidet?
Bidet all day.
Yes.
Bidet all day.
Do you have a bidet in your house?
I don't, but it's certainly something that I've thought about a lot.
We got one for Christmas and I never installed it.
You know, I stayed at an Airbnb where it had a bidet and it was such a game changer. And not only did it have a bidet, it had a heated seat as well.
Oh, nice.
And I was in Colorado, so it was like a little cold. So that was helpful.
Yeah.
But after the initial you're like, oh, this is nice. Like no hands.
So nice, right? Do you feel like it got you very clean, like especially when you were doing number 2?
Well, I'm super clean.
Oh, you're a clean pooper? That is so awesome.
Yeah. I have a really nice colon. So I'm kidding. But I
do have a nice colon.
Thank you.
You're welcome.
Thank you.
Mm-hmm.
I do think that it did the job. I mean, it's certainly, I mean, when you look at the research, there's a lot of people that are saying no to the wipes that a lot of people are using.
Oh, yeah, for sure.
Both for them and for their plumbing.
Yeah, absolutely.
So I do think Europe is way ahead of us with the bidet all day. So I'm pro bidet.
Okay. That's all I needed to know. I said that Brittany is most likely going to be pro bidet, but I didn't want to just go ahead and say that's for sure.
Thank you for knowing me and
your colon. You're welcome.
Thank you. Yeah. Okay. So before I want to just do a few little, just recap a few things.
Yeah.
First and foremost, do not be afraid of abnormal results.
Right.
And then secondly, if you do have an abnormal result, follow-up is key. And even if you've followed up years prior and you think that all is well, it really is important that you continue to follow up.
Yeah. And just schedule the pap smear, ladies. I know you're pushing it off. I know nobody wants to come and see us and do that pelvic exam. I mean, shit, I don't want to go get mine done, but just go get it done. Make the appointment, get your annual set, go see your provider, get the pap smear, and then move on. Like it really is quick. I mean, it takes for the whole time you're there and out. I mean, 30 minutes, right? So just get it done. Pap smear itself takes 5 seconds, but don't be afraid to get it done just because you're afraid of the results. I think a lot of us do that as women.
Absolutely. And go buy a bidet.
And buy a bidet and a vibrator.
The rose. Thank you. Oh God. Okay.
Oh,
well,
man.
that's all I got to say.
That's all, folks.
But and also, I hope everybody did their taxes. Go do your taxes, or at least get an extension.
Extension. Oh my God.
All right.
Well, thank you for listening, ladies.
And gentlemen, don't forget our gentlemen.
We do. We actually have a couple of them. I love that.
I know. I love it too. All right. Well, we will talk soon.
Okay.
Until next time. Bye.
Bye. The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.